are more important than the food you eat, because there's no one there to work with what you shoving into your throat. I mean, if the body is not prepared, if you're not hungry, and the hunger mechanism is a signal for us to know that the body is waiting, the body needs the food. If there's no hunger, sometimes you ask people, are you hungry? And they look at their watch as if the hunger mechanism is displayed on the screen of their watch. It has nothing to do with that. Is operating from here instead of connecting to your guts, and a lot of people are not connected to the guts. They don't connect to the inner self, to their body, and they're operating from a different level. So the hunger mechanism is a signal for us to tell us that the food is needed, and there is somebody there that is able to work with it. If you're not hungry, there is no reason why you should eat. If you eat when you're not hungry, you're actually creating excess and you're creating toxins, even if you will have the best food. So there's no reason to eat when you're not hungry, and it doesn't have to be necessarily when you're feeling unwell. It can be even when you're over ecstatic from good stuff. You're on a simcha, you're in a wedding, you're in love, you are I don't know, busy doing great things, and you don't feel like hungry, or you're exercising, or you're very, very busy in any other way, a positive way, you don't feel hungry. It's fine, you shouldn't eat, because eating and consuming food takes the most energy. It's the system that takes the most energy from us as a system in our body. So if we have no energy for some reason, because we're busy running, doing our chores, we were waiting for Shabbos. Somebody told me the other day that the Rambam said that there is a recommendation to miss a meal once a week, and he recommends that it's going to be on Friday. So I'm just thinking about it. Why Friday? Well, I understand missing a meal is great. Maybe 2 meals is even better. Some people fast 1 day a week. But Friday is the best day to do that. One reason I can come up with is because we are very, very busy on Friday. We always have to get to Shabbos on time. There's a lot of things to do, and we always get to Shabbos with the restless and stressful, and no matter how many years we've done it. Even the most experienced people I know, they get to Shabbos even in the summer, when Shabbos starts at 9:45. We still leave things to the last minute. So we're very, very busy, and we're very hectic, and let's imagine that we need to process food now, a big meal. So how will the body utilize the energy? You'll be less efficient in preparing yourself or your house. So that's one reason why you skip a meal and on Shabbos. And the other reason might be that we, on Shabbos evening, on the dinner of Shabbos, we make the best food. We make the most beautiful food. We work hard for our dishes and our meals, and we have plenty of time to sit around the table, and nobody's rushing anywhere. So we might be tempted to overeat, either because it's very, very tasty, or because there's no rush. So it's already there. It's a shame not to try. Yeah, we need to try all of it. And we make a lot of food, and we know Shelton says that variety leads to overeating. That's why he always said, don't make too many, don't go for variety, especially not in the same meal. Throughout the day, you should have different types of fruit or different types of vegetables. But in the same meal, don't go crazy with a lot of dishes, because you will be tempted to try all of them, because we like excitement, we like different tastes and different flavors. So we might be full up from salty stuff, but we might be tempted to have something with a little bit of sweetness in it. It excites us. So it's trying to feed a need through food. A lot of people eat because they're bored, or they just don't have anything else to do. So this is what I can say without going in too much depth about fasting, which is the other side of nutrition, which is one of the keys for optimum health, and it's the fourth key for today. And if you have any questions about fasting, yeah, I will take questions.
So the long fasting, which I've got no plans to do any of that, but I just wondered, the people who say have a need to do it and they go up and do a very long fast, or even a short fast that might be more than a few days, how would you know in advance how to plan how many days it should be? Like you told me that other time, do this many, and I did it. But how would a person know? Do you have to be recommended by somebody else how long you should do it?
People who are very experienced with a lot of many years of people who fasted with them, they can identify, they can analyze your situation, they can question you, and according to that they can estimate how many days you will need to fast. That's you're talking about a planned fast, like you just initiated because you want to treat a condition. So if you're doing a long fast, you want to consult with someone who has experience and can roughly give you the amount of time that you need. But again, I think the best rule is in terms of fasting is to be really tuned in your body, because the body, when you fast, the conversation with the body is so delicate, and the channels are so open and so clear. You need to be very, very stupid, sorry about the language, in order to make mistakes and just no, I'm gonna do the 21 days even though you're feeling like nothing works, and you're not relaxed and you're stressed, or you can't handle the pain. Again, if there is too much pain and you can't handle it, it's not going to work. We know in Brut, the first ingredient of Brut is joy, is simcha, is happiness. If you're not happy, we give people certain menus, and you said you have to stick to these menus, otherwise you're going to find yourself in deep troubles. And they start changing the diets, and after 2 weeks they are so depressed. So we tell them, you go back to eat whatever makes you happy, because if you're sad with your food, even the Rambam said you have to enjoy the food. I'm not talking about cheesecakes and donuts. No, not kind of that way of not that kind of indulgement. But the food has to be tasty. You have to, because if it's not tasty, then mentally, mentally first and then physically later, the gland's gonna get stuck. Then it's not gonna work. It's not gonna nourish you. So you have to be relaxed, and you have to be attentive. You have to listen to what the body says, because during fast, the conversation, the dialogue is very, very loud. There's no other noises around. So yeah, if it's a long fast, you have to have someone experienced to supervise you. Any other questions?
In a fast, obviously you're drinking.
Of course, I forgot to say, thank you. When we're talking about fast, medical fast, it's water fast. We have to drink. We're not talking about ta'anit, we're talking about water fast, how much to drink. Again, we're talking about hunger mechanism. There is a thirst mechanism as well, but apparently in most cases it doesn't operate so well. So we need to drink a little bit more than we want to, because we are all dehydrated. But the way you drink is sips all the time. You don't swallow, you don't gallop lots of water at once, because you might use a lot of electrolytes, or you're gonna ruin your kidneys. You don't want to do that. You don't want to burden your kidneys. You just want to sip, because that's the very same rate that you spend water. You always spend a little bit at a time, so you want to consume water in the same pace and in the same rate. Clean water as much as you can. There is a little bit of agreement about what is considered to be clean water. Some people say mineral water from the soil. We don't have access to those things. Some people recommend reverse osmosis. Tap water is fine. If you don't have this, then I would go for just boiled water, because I have a problem with plastic as well. So water that's set in a bottle for, I don't know, for months are also toxic. So boiled water. And it's also we're talking about energy and being efficient. It's best to eat and drink in the temperature that is closer to your body's temperature. So I wouldn't eat something from the refrigerator, and I wouldn't drink cold water. I'd like to drink water that are slightly warm, that I can still bear it on my tongue temperature. Then I know the body, because the body has to heat up. If it's cold, like an ice cream, and that's something you can try. I've tried it. We made like vegan ice cream when we had the kid's birthday a few years ago. So we just froze very, very ripe bananas. That's all. Just chop them into small pieces, put them in the freezer, and then when we wanted to make the ice cream, we just put them in a food processor, and that's it. You can garnish it with this desiccated coconut. You can put carob powder. You can put I don't know, nuts or whatever you want, or soya milk. But just the bananas on their own, it's delicious. If you like the flavor, if you like the texture of an ice cream, can't really think about it in that weather. But if you are into ice cream. But just make an experiment. Just try to have an ice cream made out of the same amount of bananas. Like, say you have 2 bananas as ice cream, and try at the same level of hunger consume 2 fresh bananas, and you will find out how long it takes to process these 2 frozen bananas. Way much time to process them, because the body is shocked by the temperature of those bananas. It needs to heat them up. It's like a thermometer. It has to heat these, like a boiler. It has to heat those bananas in order to work on these substances. It has to be in the right temperature, because all the enzymes and everything around our body, all the hormones are working. They are designed to work on a 37 Celsius degree, not on 0, not on 4. So if you're consuming something that is frozen, then the body won't be able to process it yet. It has to heat it up first, and then it gets fermented, so you lose nutrients and oxidize. And I know from experience, when I ate these bananas, I wasn't hungry for 3 hours. But when I eat 7 bananas in a row sometimes, so now, some of my meals can be 7 bananas, I can be hungry in an hour. Because it's the quicker it gets to the system, you get hungry. You need more. You feel like you're hungry again. So that's something you can experience. We know that knowledge is more experience is more valuable than knowledge. We can talk about a lot of things, but if you just leave it in the level of knowledge and you're not going to go home and start experimenting with yourself, then it's just going to stay in the level of maybe awareness in a way, but experience is something that you never forget. Yes.
So if you do just going back to how much water to consume, like you're saying, obviously that makes sense to sip it throughout the day because that's the rate that you're using. But if you say we're doing a lot of sport and you were using, or intermittently, obviously not all day, you might go and do a workout or a session where you might sweat a lot. So then, would it be all right, or better even, to put a lot in because you've just used loads?
Yes. I think it's something that you feel that is wrong. I mean, how much can you drink at once? Can you drink more than a cup?
I never can, not really, no.
Yeah, if you're really, really thirsty, I know from my experience, I can drink a cup if I'm really thirsty, but I can't drink more than that.
Yeah, me too.
Yeah.
It's too much in your stomach.
Yeah. It's just you don't feel like. So yeah, if you are losing a lot of water through exercise and sweat and different kind of weather, then you might want to consume it quicker, but you can still trust your body and you can still trust your senses, and you feel that it's too much.
What if you are really thirsty though? Then is there something wrong with you? Because sometimes I am just really thirsty, especially at night. And I think this isn't.
It's
It
because
feels like it's not really right. And
Yeah.
I've even said to Steve, why am I so thirsty? And I'm drinking. Do you drink? And he'll say no. And I'll be like, well, why am I drinking so much? Like all the time, like really.
okay, so that
Some days, but more
okay,
than
I'm just
others.
gonna repeat the questions. You said that sometimes you're very thirsty at night, and you ask your spouse, and he said, "No, I'm not thirsty, not as you,
Yeah.
not as much as you." So there are two things I want to elaborate on. First, if you are thirsty at night and evening, you're very very thirsty. It's because you
Didn't drink
you
enough in the
didn't
day.
you did drink enough throughout the day, or you were consuming foods that were dehydrating you. Okay, because if you're consuming salt and sugar and oil and spices, you cook with spices. If it's something that is very hot, very chili, black pepper. If you I'm not saying about, some people say, but I don't use a lot. But if you use them, because in terms of excess with those kind of things, every amount is excess, because we don't need black pepper. There's nothing to do with black pepper. The body doesn't have any benefit from you consuming black pepper or salt or white sugar, or sometimes even starch, or anything that is in excess. Even good food in excess is something that is dehydrating you, because you need to deal with that. So
But can
we
I just
need-
say, I eat a lot more healthy than Steve, so why am I?
So that's the
More
second
thirsty than
answer.
him.
That's the second answer. That's why I say
Because
there
I
are two
don't eat
things.
any of those, and he does.
Okay, that's the reason why he doesn't feel thirsty is because his system is depressed.
I know you've talked about this before, yeah.
So it's like
Understand.
I gave
Not aware of it.
I gave an example,
mechanism will switch
because the
off,
symptom, because a body that is strong and healthy takes the time and the energy to talk to you through symptoms and pain and starve and hunger and thirst. A body that is depressed is not going is not, it doesn't
Gives
have
up.
the energy to create symptoms. So symptom, like I say, your child has a high temperature, yeah, that's a great symptom of a strong immune system, because a weak body is incapable of producing high temperature, because creating symptom takes energy, because the symptom that the body creates are not the problem. The symptoms are already the solution. Okay, the high temperature your child is having is already the solution, because everything works quicker in a higher temperature. The mucus that you have in your respiratory, your lungs or your pipe, the mucus itself is not a problem, is already the solution, because the body creates the mucus in order to channel it out. So when people don't feel thirsty, it means that the body is not even bothering to signal them that they need to drink, because they know it's not going to be worth it. They're not in tune with themselves, they're not in tune with their body, so it's not a good sign. And the best example I like to give that everybody can visualize is a smoker, somebody who, bless you, somebody who just starts smoking. I used to smoke a pack a day, yeah, since a very, very young age. So the first cigarette, you cough your lungs out. You get red, your heart starts to beat like mad, and you feel like you're about to die. The first cigarette. You still, for some odd reason, take another cigarette later. But your first cigarette is, the body is rejecting it in all its might. But what happened to those people that are cycling and smoking? Are they stronger than me? Are they stronger than when they were when they took their first cigarette, when everything about their system said, I don't want these 400 toxins in every inhale? They're not stronger, they're just more depressed. So they're working on this kind of capacity in their lungs. Instead of using the 6 liter, they're probably just, not inhaling enough of oxygen, and every single cell in their body is suffering from lack of oxygen, though they still cycle. So symptoms are a sign of a strong, undepressed system. So that's why he's not thirsty as you. not because he's healthier, not because he's consuming more water, because his body doesn't take the time and the effort to talk to him about that. That's not a good sign. I remember many years ago, I met a lady. I used to work in Intel in Kiryat Gat in Israel, and I used to work in the clean room. In the clean room, you have these massive vents and filters that sucks all the air in order to keep the room very clean. And you're wearing all these helmets and these suits in order to protect the wafers, these products, the chips that you're creating from dust and everything that comes out of your skin. So you all very clean, but because there's a lot of ventilation, you're very thirsty. So do you have these like bars in the chases inside with like mineral water, and you were supposed to drink as much as you can. And I remember there was a lady who I used to meet every time I went to drink, and when I saw her, working, I said, "Come and have a drink with me." I'm talking about 15 years ago. I didn't know anything about natural health, but I did know that water is important. And she said, and I always grabbed her. I said, "Come and have a glass of one of these tiny little plastic disposable cups." And she said, "I'm not thirsty." I said, "How can?" He said, "I never drink a glass a day. If it wasn't for you, I wouldn't even consume that cup." I said, "So what do you drink?" He said, "I drink Coca-Cola." And I said, "Then you're not thirsty?" He said, "I'm not thirsty at all." So this is and she was slim and she was young, and she wasn't bothering herself of what's going to happen but every time you drink, people count Coca-Cola as a fluid, or coffee or tea. But actually, when you're counting how many glasses, I don't suggest you will count, but let's say you are counting, and you said, "No, I drank 10 cups a day. One of them was coffee, one of them was Coca-Cola." For every Coca-Cola or coffee that you drink, your body spends a cup or two in order to eliminate these horrific acids. So you can't count them, even though there is water.
The government health guidelines tell you to include that as fluids.
The government
health guidelines.
The government health.
I've read it. I've seen it loads of times where it'll say
it says
you can include tea or coffee in fluids cups. You should drink this many a day. Is it 8 or something that they recommend? And included in that can be coffee or tea.
Yeah, but
government health.
That doesn't mean they're right.
The government,
isn't this ridiculous?
Yeah, but the government health guidelines are the same guidelines that bring us to early death and lots of chronic illnesses. That's fine. I mean, if you follow the government guidelines, you will probably end up sick and die ugly and early, because these are they're not trying to change anything. They're just keeping the same routine. They didn't
used to have coffee or tea, but I think it's because it's trying to get people to drink.
Yeah.
It doesn't matter what. Yeah.
So at least start drinking.
Yeah. I
think that's partly because at first they didn't have tea or coffee
as in not alcohol.
Well, yeah.
Because otherwise it'd be go in the pub and drink
3 pints a day.
But I don't think we have that luxury to just shoot very, very low.
Yeah.
Or you just drink alcohol, don't shoot heroin because it's really bad for you. So just drink coffee and, that kind of a drug. We're shooting very, very low, and we're not giving enough credit to the public. And I know that firsthand, that because they think that people won't be able to handle some of them. I'm not saying all of them, because some of them don't even know what health is all about. So it's not that they're keeping it as a secret, what are the laws of nature and how we actually need to behave, because they don't understand anything about nutrition. Doctors don't study nutrition. They don't. Even these ladies, the nutritionist in the clinics, and you have hypertension, they send you to the nutritionist, to give you a diet. They don't understand anything about nutrition. They copy this food pyramid, which is a guarantee that you'll die early and ugly, that food pyramid. So they say, in one hand, they say, okay, we're not going to tell the public what really needs to be done, because they're not going to be able to do that. So they're going to go completely blind, and they'll just lose faith in the system. That's one thing that they do wrong. And another thing is that they don't even know what's the right thing to do. They're not working this. And I've talked about it yesterday. I said that early diagnosis, they always come and the smear test, all these early testing, it has nothing to do with preventive medicine. Preventive medicine, it's, how do you call it? Early diagnosis? How do you? Yeah.
Diagnosis.
Yeah, early diagnosis. It's not, they brag, okay, we are, I see it in, I haven't been to a clinic for many years, but the last time I was there, there were posters saying, we are working for preventive medicine, come for your pre-screening, come from your mammograph. This is not preventive medicine. Early diagnosis is not preventive medicine, because if you diagnose this disease, you are already ill. Preventive medicine means that you are educating people not to get ill, not even the early stages, because they're gonna medicate you for a longer time, maybe with milder medications, but they're still gonna medicate you. That's the best thing they can come up with. Early diagnosis, it's ridiculous. So we can't really trust, and some of us want to trust what the authority is telling us, but I don't think I mean, the people here, I don't think they can allow themselves the benefit of trusting what the authority has to say about health, because it's doomed to disaster. I mean, it's already disaster anyway. We don't have a lack of budget. We don't have a problem with sewage. We don't have a problem with access to clean water. We don't have a problem with organic. We don't have a problem with anything, and we're still sicker than ever. That's ridiculous. Why? Because we will go in the wrong way, and we're listening to those people say, go to the food pyramid and take your... We must change. We must do some radical changes. Otherwise, we are very, we're the wisest creature in nature, but we are, in terms of health, we are the dumbest creature in nature. I mean, animals do way better than us. I'm not talking about domestic animals, but animals in the wild, if we're not interfering with their habitat, they do much better than us.
Because we've discovered white sugar, starch.
Sorry, I have to.
Okay, so I will finish for today, and hopefully next week we're gonna continue with the 5th key of health. So thank you very much.
Thank you.